Wheatland Dental is obviously a dental office, general dental office. We treat all phases of dentistry, and our basic philosophy is to treat people like we would like to be treated, and that's our whole office and staff philosophy. Is we say that we're in the health and happiness business. Everyone that's in a business is in some kind of a business, but we tell people that we're in the health and happiness business, not in the tooth business, and we try and stay on the cutting edge of all phases of dentistry, and especially how it integrates with medicine, because we're not just treating teeth. We're treating the whole body. And the mouth just happens to be part of the whole body, and of course, obviously an integral part of the whole body. But you've got to understand how it integrates with the rest of the body. So that's why we say we're in the health and happiness business.
There's been so many stories through the years that have really touched our hearts. Things that have made a real difference in their lives. Everything from a perio patient who's had multiple miscarriages due to bacteria from gum disease. And I had a lady years ago that had 4 miscarriages, and I'm a mom. And this hits home with me. You know how precious your children are. Well, she had such bad gum disease that there's an enzyme that's produced that starts labor. And so if she had had the best OB and bed rest, she could not probably have gotten a healthy baby here. So we treated her husband, and 11 months later, they had their first live birth. Now those kind of stories, it carries you. And we spend so much time here that this is kind of like our home, and our other home is our home away from home. And we look at these folks, we've seen 2nd and 3rd and now 4th generation patients. That tells you how long we've been doing this. So this is our family. Our staff is really precious to us, and our patients are really precious. And they are guests here. I want them to walk out of this place feeling well taken care of, and that we care for them beyond their teeth, beyond their smile, that we're involved in their lives. We watch how things progress for them. We want them to do well because they were here. We've worked together for a long time.
I hired her.
Did you?
Yeah.
Yes, he did. For us, this is how we make our living, but this is like a mission for us. Some people go and do mission trips away from here, away from where they work, but for us, our greatest mission is right here, the people we serve every day. And so, Harry, we joke about Harry's not a golfer. He does like anything with a motor, whether it's a car, a plane, or a handpiece. But, some people can look around and say, oh, we've done these trips or that trips. And sometimes we've done some neat things like that. But really, what's been rewarding for us is the people that have come here from other parts of the country and had some unique problem with their mouth, with their teeth, that he's been able to help them with. And that's been very exciting. We had someone that came here years ago that were on vacation, came to Dallas for 2 weeks, and had a severe trismus, and one of the hotels in Dallas happened to send them to us. And she wrote us this wonderful
Where she couldn't
letter.
open her mouth.
Had gotten an infection, and that was going to ruin her vacation that they had saved for. And he was able to help her, and because of some of the equipment we use, it made a quick difference in how she felt. And so
she was able to leave the next day.
And they were able to enjoy their vacation, and we still have that letter from quite a while back.
Yeah.
So
Wheatland Dental is a family.
well, it's a family practice, and
Your daughters?
And our daughters are involved, right?
Laura's a dental assistant, and Jacqueline helps work at the front desk, works things on the computer and with things with social media. And then ever since the girls were tiny, I've taken them to do health fairs at lots of churches around here, lots of companies around here, and the girls would help me. They would shake hands and pass out cards. We live just a few minutes from here, so we're real involved in the area, and we've been here for 30 years, so we've watched it grow, watched it change, and we really like knowing our area very well.
Love it.
You know, this building has a copper roof, and Charlton Hospital is about 2 blocks up
Yes.
here, and there are tons of people that know where this office is that don't know where that hospital is.
Oh, there's so much to learn. Dentistry's changed so much. And I will say, you know, I've lived with a guy for 30 years. I mean, we are married, but it's like I have never seen anyone that has such an insatiable desire to learn and be better. And there is so much to learn, and it's hard to stay up on it all. So that's why we really enjoy learning from our friends that are, you know, recommending things to us. Whether it's nutrition, how that complements our practice, whether it's the neuromuscular courses he's taken. I mean, it's been huge.
Just a common thing like chronic headaches. We're able to help 99% of the people that have been taking pills for, you know, 20, 30 years and have periodic migraines, headaches all the time, and usually within a very short period of time, I mean like days, we get them over that. We had a lady, real quick, we had a lady a few years ago that had been taking 3,200 milligrams of ibuprofen, which is the max, every day for 17 years. And it was a wonder she hadn't any stomach. And June the 1st of 2006, I inserted the appliance. June the 2nd, she took her last ibuprofen.
Just watching the families change and grow, and even with our staff, we have staff members that have been here with us over 20 years, and so we've literally grown up with them. And you know, you spend more time with the people you work with than many of your relatives, and so you know, you hope you really have a great relationship, because it would make it makes life more pleasant. When I talk to people, and there are many good dentists in our area, the thing that sets him apart is that this is more than a business. You know, I talk to so many that just can't wait to hit the golf course or can't wait to hit the Bahamas, and that's well and good. I have nothing, you know, against that, but I'm telling you, this guy has a passion for learning and being better, and he really takes to heart that this is his mission, to help folks with their smile, but with their overall health. And he takes that is really something that he thinks about seriously and wants to learn to be better so that he can help them be better. He feels like it's kind of like he sends them out in better shape than when they came to us. And they become better consumers. You know, they feel better about themselves. It is amazing how having a ready smile helps people to communicate better. It has people react to them better. And he has those kind of stories. And whether it's helping our staff to feel better about themselves, because a lot of the folks that come to us haven't had good dental care when they come to work here. And so they learn more about it. And he takes good care of them and then helps them to educate the people that come here. You know, oftentimes when people haven't taken good care of their teeth, it's been something that they didn't realize how important it was, or they were just busy. And I talk to folks and I say, I'll ask them, and whether it's a teenager or an older person, how many cars have you had in your lifetime? How many do you think you'll have? And I said, and you take pretty good care of it? And it's amazing. The men always do. I mean, I've had guys that tell me when their last oil change was, but couldn't remember when their wife's birthday was. They'll say, it's when the World Series is. Let me think. And we got married too. Let me think who was playing. I mean, I hear that so many times. But I'll say, now, how many sets of teeth are you going to have? And it's amazing how I get this deer in the headlights look like, oh. And some people will say, well, I thought I'd just get implants. And I said, but you know, if you get an implant, the same bone that holds these teeth in will hold an implant in. So if you don't have good bone support now, you probably won't have good bone support then. So it's just kind of making it more of a reality that, you know, your teeth are something you hope you have long term.
I read an article a few years ago that said that the first time that an animal in the wild loses one tooth, it's just like downhill from there. I just thought that was so interesting.